Good morning. My name's Rob. I'm one of the cardiac rehab supervisors at Toronto Rehab, and today I'm going to be talking to you about reversing heart disease and improving coronary blood flow. Now hopefully, by the end of today's session, you will understand that evidence does exist to show that we can, through lifestyle modification, at the very least slow down the rate of progression of coronary artery disease. In many cases, we can even do one better. We can stabilize your disease. So you might have some blockages, but we can make it so that they don't get any worse. You'll also understand that there are cardiac tests out there that we have to take a look at blood flow through the coronary anatomy and to the heart muscle itself. And lastly, we want to increase your depth of knowledge about the role that exercise has in reversing heart disease. Now, many of you have been on the program for several months, and I'm sure in that time you've heard an awful lot about the risk factors for heart disease. Diabetes, cholesterol, high blood pressure, obesity, smoking, exercise, to name but a few, because there is quite a lot. Well, our goal with educating you about all these risk factors is to help you get them under control, because evidence exists to show that if you do get your risk factors under control, many of you will be able to stabilize your disease. So yes, you might have a few blockages in there, but if they're stable, they're not going to get any worse. You're going to be able to live a nice, long, healthy, productive life with no further concerns at all from heart disease. And that's pretty much our goal with everybody. Now, I've mentioned the term heart disease a couple of times, and I really need to clarify that. In particular, I'm talking about coronary heart disease. So we're talking about blockages in the coronary arteries, blockages that decrease your body's ability to deliver oxygen-rich blood to your heart muscle itself. The process of coronary artery disease actually begins quite early in life. Typically, it begins in our late teens, early 20s, and it begins when something acts on the lining of the coronary artery to damage it. And our body, sensing damage in the coronary artery, sends a whole bunch of chemicals and compounds in the blood to try and heal it up, which is the good thing to do. Much like getting a cut on your skin, you're left with a scar. Getting an injury on your coronary artery, you're left with some scarring as well. But what happens with the damaged coronary artery is over time, more and more things are deposited behind this scar into the wall of the artery. Cholesterol, smooth muscle cells starts growing through there, white blood cells, calcium is deposited. More and more things start piling up in the wall of the coronary artery behind this site of damage. And as more and more things starts building up, it starts to swell, it starts to get larger, it starts to grow. As this blockage starts swelling in size, it leaves less and less room in your coronary artery for the blood to flow through. Eventually it might get to the point where it causes chronic blood flow problems, which will leave you feeling angina. It could be the blockage in an area of your heart that's quite important and requires some kind of intervention. They might go in and put in a stent, or perhaps you require bypass surgery. Or sometimes these blockages will rupture and they'll cause an acute event like a heart attack, and I'm sure many of you are familiar with that. The disease itself is a progressive disease, okay, unless you can get your risk factors under control. Because as I alluded to earlier, getting your risk factors under control, the evidence shows that we can actually halt the progression of disease in most people. So many of you are here in the center image. You've got some blockages, but those blockages are nice and stable. The usual course of the disease, as we said, it's a chronic progressive disease. Fortunately, it progresses slowly. Typically, it's a progression that takes decades for most people. But what about the other option? What about getting our risk factors under control, working really, really hard? Can we improve on the situation? Can we take existing blockages and make them decrease in size? Can we make them go away? Can we reverse heart disease? So that's what we're going to take a look at today. And we're going to start off by looking at a study that was done by a gentleman named Dean Ornish. He's a physician that works out in California, and he's known for the lifestyle heart trial. This was a study that was done back in the early to mid 80s, and the goal of the study was to see, can we actually reverse heart disease, coronary heart disease, in mankind? Because up until the mid 80s, we didn't think it was possible. So what Dr. Ornish did, quite simply, he took a group of 48 people and split them up into two halves. Half of the people participated in the Dean Ornish program. The Dean Ornish program has 3 components. One component is stress management. Second component is regular physical exercise. And the third component is an ultra low-fat diet. So half of the people participated in that program for 1 year. The other half were randomized into the control group, or the usual care group. That means they did the usual things that heart patients did back in the mid-80s, early 80s. Go see the family doctor, cut back on the smoking, try and lose a few pounds, typical stuff. 1 year later, they brought all 48 people and they did angiograms on them again to take a look and see what happened to their blockages. And what they found is in the people that participated in the Dean Ornish program, their blockages actually decreased in size by about 2% on average. And this was very exciting news because, keep in mind, up until now, nobody thought you could actually reverse heart disease. So this was very, very exciting discovery. So 2% smaller on average compared to the usual care group, and they demonstrated the usual course of the disease, their blockages actually got worse by about 3% on average. Now, a lot of people will take a look at this study and say, okay, it's nice, but I mean the numbers are very small, 2%, not very significant. And while the actual size of the blockages are not very significant, one thing that's good to know is that for every 1% in size you change a blockage, you actually improve on your blood flow by about 4%. So this 2% improvement in blockage actually gives you about 8% more blood flow. That 3% worsening actually makes your blood flow 12% worse. If you take a look at the difference, that's about a 20% swing in a period of 1 year. And if you look at it that way, it's much more impressive, much more significant. A lot of people have spoken with Dr. Ornish about a study, and they always say, listen, Dr. Ornish, you had 3 components in your reversing heart disease program, diet, exercise, and stress management. We're busy. We can't do all 3. Where should we put most of our efforts? And Dr. Ornish will typically reply with something along these lines. Heart disease is a very complicated process. It's impacted on by many, many different factors. And as such, if you really want to increase your odds of stabilizing or reversing disease, you need to address it holistically. You need to look after all of your risk factors, try and get them all under control. And the more risk factors you get under control, the greater your odds of experiencing regression are. And that's a view that we here at Toronto Rehab agree and support with. That's why we talk about so many different risk factors. Shortly after Dr. Ornish did his study, another gentleman, Dr. Hambrick out in the University of Heidelberg in Germany, did a very similar study, wanted to replicate Dr. Ornish's finding to show that yes, we can reverse heart disease. So what he did is he took a group of 62 people with documented coronary artery disease by angiogram, split them up into roughly 2 groups. Half of the people participated in Hambrick's program for a year. Hambrick's program really only had 2 components. One side of it was exercise. He wanted his patients to exercise 5 days per week, and he also wanted his patients to follow the American Heart Association Step 2 diet. And if you've never heard of that diet, basically it says that no more than 30% of your calories should come from fat, only 1/3 of those should be animal fat, no added salt, lots of fiber. I hope you all understand this diet is pretty much the same as the advice that we give our patients here at Toronto Rehab. The other half of the patients were randomized to the control group, which means they did the usual stuff that heart patients did in the late 80s, early 90s. 1 year later, Dr. Hambrick brought all of his patients back and did repeat angiograms, and his findings were similar to what Dr. Ornish found. He was able to demonstrate that 28% of the people that participated in his program experienced some kind of regression. Their blockages got smaller. Once again, very exciting news. This actually confirmed what Dr. Ornish found. We can actually reverse heart disease. 62% of people were able to stabilize their disease. So no, their blockages didn't get any smaller, but they didn't get any worse. Once again, that's a good thing to have happen as well, because stable disease means you're going to be able to live a nice, long, healthy life without any concerns. 10% of people actually demonstrated a progression of the disease, which is an unfortunate fact of life. Some people do have very aggressive disease, and the best we can hope in these people is to actually make it progress at a slower rates. And that's just an unfortunate aspect of the disease. Compared to the control group, in the control group, only 6% of people were able to demonstrate any kind of regression. And that makes sense because in any group of people, some are very highly motivated. They go to the family doctor who says, lose a couple of pounds and start exercising. Guy loses 50 pounds, starts running marathons, and sure enough, he experiences a little bit of regression. 49% of people stabilize their disease, but the big difference is the last group. 45% of people demonstrated the usual course of the disease in that their blockages actually continued to progress. They got worse. So knowing that Dr. Hambrick was going to be asked the same questions that they asked Dr. Ornish about exercise and diet, he took a little bit of a closer look at things. In particular, he took a closer look at the exercise. And what he found was that in the people that tended to demonstrate a worsening of their disease, they exercised by and large about an hour and a half or less. The ones that stabilized their disease, so no better, no worse, they exercised roughly 3 hours per week. And the ones that demonstrated a regression, decrease in the blockages in the arteries, they tended to exercise about 5 hours per week. So he took a look at these results and then went on to make this statement. He said that about 1,500 kilocalories per week of physical activity is necessary to halt the progression of coronary atherosclerotic lesions. Translated into English, we burn about 100 calories for every mile that we walk. So he is saying that you've got to walk about 15 miles per week to make your blockages not get any worse, to stabilize them. He then went on to say, regression of coronary lesions is observed only in patients expending an average of 2,200 calories per week, which works out to about 5 or 6 hours of regular physical exercise. So if you want to reverse your disease and make those blockages get smaller, you got to try and walk 20 to 22 miles per week. Now, a lot of people see this slide and they always get a little discouraged because, let's face it, not everybody here is or is able to walk 20 miles per week. And the good news is, not everybody needs to. Remember that coronary artery disease is a progressive disease, but the rate of progression varies person to person. Some people have very aggressive disease. It begins in their teens and progresses quite quickly, and they end up with heart problems in their 30s, maybe in their early 40s. These people have got aggressive disease. It needs to be managed aggressively. These are the people that we want to be pushing to 20 miles per week. If your disease is a little less aggressive and it's progressing much slower, and you don't have heart problems until your late 70s or maybe into your 80s, a lot of the time, because your disease is not as aggressive, it doesn't need to be managed as aggressively. 10 to 12 miles per week is probably enough to stabilize your disease or experience a little bit of regression. And that's a good thing because, let's face it, once we get into our late 70s and early 80s, many of us, our joints are not what they used to be. To try and walk 20 miles per week is probably not a good idea. We'll be damaging our joints a little bit too much. Okay? So that's the one thing you need to take away from this slide. The second thing you need to take away from this slide is that every little bit helps. If you're walking 2 miles and you want to walk 2¼ miles, it's only a small increase, but that small increase done 5 times per week, 52 weeks per year, really adds up. It burns an awful lot more calories, and burning those extra calories is what contributes to your odds of actually getting your blockages to decrease in size. So if you can walk a little bit further, it's a really good idea. Now, I think if someone were to come up to you and say, listen, get all your risk factors under control, do all these things, your blockages will get smaller, that's a good thing. I think we'd all agree with that. But for the skeptics in the crowd, they've actually done a meta-analysis, which is a study of other studies to show that this is true. So this is a study that took a look at 5 other regression trials. And what they found in these regression trials is that people that were able to demonstrate the blockages getting smaller were roughly 30% less likely to suffer from heart attacks, 26% less likely to suffer from angina or chest pain, 65% less likely to require bypass surgery, about 13% less likely to require balloon angioplasty. So this actually shows exactly what we had anticipated. Getting blockages smaller is a good thing, and this proves it. I want to show you a couple of examples. This is an image of a nuclear stress test. And for those of you who are not familiar with nuclear stress tests or nuclear perfusion scans, they're also commonly called cardiolite or thallium or sestamibi. Usually what they do is they take an individual, they put them on a treadmill, and they get them to start exercising on the treadmill. Every few minutes it gets a little bit harder, a little bit higher, a little bit faster, till eventually you can't do any more. When you reach the end of the test, the doctor will go and put a needle in your arm and inject a radioactive dye. There's a variety of dyes that they can inject, thallium dye, cardiolite dye, and a number of others. This dye binds to your blood, and then everywhere through your body the blood goes, the dye goes with it. So they put you on the treadmill, they get you to start exercising, end of the test, inject the dye, take you off the treadmill, and they put you on this big table. And then a camera passes over top of your chest, takes a whole series of images of your hearts, puts all these series of images together, and hopefully you end up with an image like we have on the screen. This is an image of a heart that's got no blood flow problems. The entire heart is full of oxygen-rich blood, and we know that because it's a full, complete circle. This is an image of a heart that's got blood flow problems. The resting image shows there's no concerns with blood flow at rest because the person's not doing a lot of work. Once the person starts exercising, we can see part of the ring is missing. There's an absence of blood flow. And that implies that the artery that is supplying that part of the heart has likely got a blockage in it because it is restricting the blood flow. So this particular individual, after having this test, began participating in a cardiac rehab program. They worked quite hard. They exercised regularly, very rarely missed a day, got all the risk factors under control, took all their medications as they were prescribed. A year later, they repeated the stress test, the perfusion scan. And what they found that a year later, his blood flow had improved dramatically because now we can see that the ring is complete. Blood flow has been restored. And that's due in large part because of a decrease in the blockage that he had in the artery supplying that particular part of his heart. Another example of a new type of test that's coming out is something called IVUS, which stands for intravascular ultrasound. It's similar to an angiogram in that they usually will get to your heart by putting an incision in your groin and threading a catheter up to your heart. But whereas in an angiogram they squirt dye down the coronary arteries, with the intravascular ultrasound they actually thread an ultrasound probe down the inside of the coronary artery. And what this allows them to do is it allows them to measure the amount of blockage that you have, the amount of substance in the blockage in your coronary artery. So this is another example, and you can see that on one side the atheroma is measured at 13.0 millimeters squared. That gives us an idea in terms of how big the blockage is. Okay? This person once again participated in a cardiac rehab program, did everything that they were supposed to. A year later they had a repeat intravascular ultrasound done, and the size of the blockage had increased dramatically, down to 7.4 millimeters. So once again, this is another very nice example showing us that blockages, heart disease, can be reversed. I know many of you are taking cholesterol pills, Lipitor, and many other types of statins. There's a great deal of evidence that has been, a great deal of studies that have been taking a look at the role of cholesterol-lowering pills in heart disease. And one of the things that we found is cholesterol pills play a dramatic role in sucking the cholesterol outside of the blockages, if you will. They really increase your odds of getting heart disease or blockages to decrease in size. Now, I think most people would say that's obvious. If you have a high cholesterol, put you on a cholesterol pill and it's going to be beneficial. But the evidence that exists also shows if you have a normal cholesterol and we put you on a cholesterol pill, that we greatly increase your chances of experiencing regression or having those blockages decrease in size. So that's one side of the equation. If you've got a blockage in a coronary artery, if we can make that blockage decrease in size, we know that by doing that you're going to have improved blood flow. The other side of the equation is, what about maybe growing new blood vessels? Growing something called collateral arteries or creating collateral circulation. You're all familiar with this to one degree or another because this is a lay version of saying it's a natural bypass. You know that in bypass surgery, if you have a blockage, the surgeon will open up your chest, they'll take a piece of vein from your leg, stitch one end into the aorta and the other end beyond the blockage, and they're just creating a detour for the blood to get around the blockage and improve the blood flow to your heart. Our bodies have been doing this for a dramatically long period of time, growing our own natural bypasses. We can see in our example, we've got a normal healthy artery with a certain number of blood vessels. The image below that shows a blockage in that coronary artery. Now the heart is a wonderful thing. If it's got a blockage in one of its arteries and you continue to exercise under safe guidelines, that's your way of telling your heart that I'm exercising, I need good blood flow, try and fix things. And then what the heart will go about doing is it will grow its own natural bypasses around that blockage, and it will dramatically improve blood flow. And we've had instances where patients have had 100% blocked coronary arteries, which you'd normally assume would result in a heart attack. But these individuals have had a dramatic amount of collateral arteries formed around that blockage over a period of time to prevent any myocardial or heart damage. So it works very, very well. And here's another example of the same collateral circulation with a blockage in a coronary artery, and on the other image, all the collateral arteries that have formed to improve blood flow. The only way to get collateral arteries to form is through exercise. There's no food you can eat, there's no medication that you can take that will help you with this. If your heart has got a blockage and you sit down and do nothing all day, your heart has got no reason to get better. If you've got a blockage and you participate in a regular exercise program, that's your way of telling your heart that it needs to improve, and bless our hearts, they'll actually improve dramatically by doing things like growing collateral circulation. So that's another way to improve our blood flow. Works very, very dramatically. So just to wrap everything up, we know that there's research out there to show that we can stabilize heart disease through changing our lifestyle. It's not just about drugs. Getting your risk factors under control is very important. So I encourage everybody to take a look at your risk factor profile, find out which ones are not under control, and do everything that you can to make sure you get them under control. We also know that there are a variety of special cardiac tests that can be done to take a look at blood flow. Angiograms are one, perfusion scans we talked about, they're an excellent way to take a look at blood flow, and some of the new emerging technologies like IVUS, intravascular ultrasounds. And lastly, walking is important. The more you can walk, the more calories you burn, and it's that caloric expenditure which really seems to be the big key factor in terms of stabilizing your disease or getting regression or reversal to occur. So the take-home message is, we know it's possible. We ask, can we reverse heart disease? I think we've shown that yes, we can. Get all your risk factors under control, all of them. Don't just exercise, that's not good enough. You need to make sure you look at the big picture. Take your medication as prescribed, especially those statin pills. They play a dramatic role in terms of stabilizing and reversing heart disease, and exercise forever. I know our rehab program here is only 1 year in length. When it's over, that doesn't mean your walking is over. You need to exercise for the rest of your days. Thank you very much.